My name is Dr. Melissa Houston, and today I am pleased to share with you information from the Centers for Disease Control and Prevention regarding what to do if someone becomes ill or is ill with COVID-19 during a trip. The actions that you would need to take are summarized in 5 steps. 1. Preparation. 2. Isolation. 3. Transportation. 4. Notification. And 5. Disinfection. So let's get started. Step 1. Preparation. As you begin the planning process to resume in-person church services, one thing that you should consider is what would you do, or what would the processes be if someone became ill or was ill with COVID-19 during a church service. This video is designed to help you think about the issues that should be considered. Step 2. Isolation. If you suspect or someone exhibits any of the symptoms of COVID-19 during a church service, they should be immediately isolated. Some of the symptoms of COVID-19 include cough, shortness of breath or difficulty breathing, fever, runny nose or congestion, fatigue, muscle or body aches, new loss of taste or smell, nausea, vomiting, or diarrhea. It is important that if there were any children that were accompanied by the person that requires isolation, not be left alone without adult supervision. Number 3. Transportation. It is important that there are plans and processes in place to ensure the safe and effective transportation of someone that you suspect of becoming ill or having COVID-19 during a church service, either to their home or a healthcare facility. Some questions that you would need to consider would be, what criteria will you use to determine whether a person is transported home or to a healthcare facility, and how will they be transported? Would it be in a church van, a personal vehicle, or an emergency vehicle? Step 4. Notification. It is important to immediately notify local health officials if a person diagnosed with COVID-19 had been in your facility. And while it's important to notify healthcare officials or local health officials, it is important to remember that you need to maintain confidentiality as required by the Americans with Disabilities Act or other applicable laws when communicating information about a suspected exposure to staff and congregants. And finally, step 5, disinfection. Immediately close off areas that were used by the sick person and keep them closed until those areas could be properly cleaned and disinfected. It is important that who's ever responsible for cleaning and disinfection use safe and correct application of the disinfectants. For example, they should wear disposable gloves when they're cleaning and disinfecting the area. Clean surfaces first, using soap and water prior to using a disinfectant. It is recommended that you use an EPA-registered household disinfectant for the disinfection process. Follow the instructions on the label, as many disinfectants require keeping the surface wet for a certain period of time and making sure that good ventilation is available when using the product. More information can be found at www.cdc.gov. Thank you for the opportunity to share this information with you today.